Hi friends, I am Dr. Govind Narayan Purohit, the former head department of veterinary gynecology and obstetrics, College of Veterinary and Animal Sciences, Rajasthan University of Veterinary and Animal Sciences, Bikaner. Friends, if you have already subscribed to my channel, I am highly thankful to you. If you have not already subscribed, kindly do subscribe to it so that you receive my video lectures very fast. And friends, we are discussing the various topics of theriogenology in our classes, and in our today's lecture we discuss something about the embryo transfer technology in cattle. As you know, embryo transfer technology has been uh, a technology which has been very much discussed, and now embryo transfer or multiple ovulation and embryo transfer, as it is known as, it involves the removal of a embryo from a donor female. Say this is the donor female. We remove the embryo from this and placement of the embryo in the reproductive tract of a female of average genetics. This is a donor cow of high merit, high genetic merit, and the embryo is taken out from this and it is put inside the uterus of a low genetics cow, and this cow becomes pregnant and gives birth to a calf or a heifer. Now this donor is induced to MOIT, multiple ovulation. Now we talk something about what is multiple ovulation or what is other things. The goal of embryo transfer basically is to obtain the maximum number of genetically superior embryos in a minimum amount of time. So if a cow it is going to give birth to one calf a year, at the max it can give birth to 25 calves in her lifetime. This is maximum. Now, if we want that, we want more number of calves from this outstanding donor, then we will have to go for embryo transfer. So this is the goal, to obtain the maximum number of uh, genetically superior embryos from a donor. Now, obtaining uh, multiple embryos from an outstanding female. Say this is a outstanding female and we want to obtain the maximum number of embryos from this female combining with a outstanding male. The then the another objective could be, purpose could be, transport the genetics across long distances. If you want to transport uh, cows from UK, uh, then it will be very cumbersome, but we can easily transport the embryos from any country to another country, and they can be transferred to the recipients at your place. Actually, the interest in bovine embryo transfer, it began in 1980s when European dual purpose breeds of cattle were in great demand. And because of the quarantine measures applicable in different countries, it was really very difficult to transport cows. So the idea came of obtaining the embryos and then transporting them to long distances. And also the embryo is resistant because the embryo has a zona pellucida, and this zona pellucida is resistant to many organisms. So again, it is beneficial to transfer the embryos instead of transporting the female cows. Then production of twins by embryo bisecting. You take one embryo, bisect it into two halves. Say this is a embryo, and we have divided it into two halves, and each half is then develops into another embryo, and so production of twins by embryo splitting. This is another mandate. Now, an important point here that starting embryo transfer, you require a mandate. And without a mandate, embryo transfer will never ever replace artificial insemination. You cannot replace artificial insemination with embryo transfer. So the mandate should be the production of the bulls, the best bulls, and production of a closed herd wherefrom you can obtain further bulls to propagate through artificial insemination. Now, for this purpose, one has to be very careful that you have to select the elite animal. If you don't have the elite animals, then it's useless to go in for superovulation and embryo transfer. You need to have the elite cows. The cows, what are elite cows? Cows which are having production above the herd, and exceptionally above the herd. They are the elite animals. Now, what are the benefits of embryo transfer? The very first thing which I have mentioned, it allows the production of many offspring within a year from a single cow. Within a year, if you receive so many calves or heifers from a single cow, then it is beneficial because that cow is outstanding for you and you need to propagate this cow along with propagating the qualities of the bull that you have. So that is an important benefit of embryo transfer. Then there is an increase in the genetic potential. Uh, the increase in the genetic potential, increase in the milk production, and increase in the weaning weights. So these are some of the benefits of the multiple ovulation and embryo transfer. Now, what are the limitations? Embryo transfer involves a lot of cost, so it is expensive, and then uh, a person who wants to collect embryos and then transfer it to recipients, he needs training. So he requires to be trained in those new skills. Then a lot of work has to be done for embryo transfer. You have to superovulate a animal, then you have to inseminate a animal, then you have to collect the embryos, then you have to transfer the embryos. So a lot of work has to be done for multiple ovulation and embryo transfer. And then another one of the most important thing in multiple ovulation and embryo transfer is the highly variable ovulatory response. A cow may give up to 50 embryos at a time, and the same cow may give no embryo at other times. This is because the physiology of cattle is very complex, and we have understood the physiology only to a limited extent. Now, as I said earlier, that the interest in embryo transfer originated in 80s when European dual purpose breeds of cattle were in great demand. Now you can see in this table that the first successful embryo transfer was done in rabbit by Walter Heath in 1890, and 100 years later, almost 100 years later, the first successful superovulation of cattle was performed in 1940 by Cassidy, and in 1951, the first successful embryo transfer calf was born because of the works by Willett and his associates. Now, the first embryo transfer buffalo calf was born in the US because of the work of Martin Drost and his associates in 1983. Then the embryo transfer in India. The first embryo transfer calf in India was born at National Institute of Immunology, New Delhi. The first buffalo calf in India was born at Sabarmati Ashram Goshala, Bidaj. The first camel calf was born at NRC on Camel, Bikaner. and the Rajasthan state's first embryo transfer calf was born at College of Veterinary and Animal Sciences, Bikaner. So this is the brief history about the embryo transfer. Now, I have purposely shown this table that the total production of transferable embryos of in vitro derived and in vitro produced embryos in 2019 in cattle, uh, according to region, the biggest producer of embryos by in vitro as well as uh, in vivo derived embryos is North America. You can see here, North America continues to be the biggest, followed by Europe and then South America, and lastly Africa. The data for Asia was only 94 embryos because the data, the ITS data collection committee, it has mentioned that the in Asia, most of the countries have not responded to their request. Now, in our country, uh, in India, the Rashtriya Gokul mission has been started by the government of India, and 20 embryo transfer technology centers are being established in India. A proposal of 19 centers has been approved so far, as per the Honorable Minister Radha Mohan Singh ji, what he said on 18 September 2018. And I presume that by this time, most of the centers have become functional and they have started functioning under the Rashtriya Gokul mission. Now, what are the components of embryo transfer? What is to be done? First of all, we have to select the donors, and donors essentially must be high genetic uh, potential uh, donors. They must have a superior genetics. If they are not having superior genetics, then it's useless to include that animal as a donor. So the first thing is donor and recipient selection. So, and recipient can be of low genetics, they can be of low genetics, but essentially they must be fertile. Uh, some people, they have a misconception that the recipients could be infertile animals also, but they should be fertile. Now, the donors must be elite animals and they must be producing milk above the herd average, much above the herd average. So, the donors are put to multiple ovulation or what we call the superovulation. The superovulation can be defined as the induction of multiple ovulations in a monoovular species, essentially, maybe cattle, maybe uh, mm, buffalo, maybe mare, and the animals are injected with the follicle stimulating hormone. For superovulation, essentially follicle stimulating hormone is given. Then after superovulation, a prostaglandin is given. 1 day ahead of the donor, a prostaglandin is given to the recipient. Estrus is detected both in the donor and the recipient, and nothing is being done to the recipient. It is kept confined. Whereas in the donor, estrus detection and insemination is being performed when the animal is detected in estrus. Now, 7 days after the insemination in cattle, and 6 days after insemination in the buffalo, day 6 in the buffalo. Why day 6? Because buffalo embryos, they reach the hash blastocyst by day 7, and then they become difficult to handle and they become difficult to identify also. So on day 7, embryos are recovered by non-surgical methods. Currently, non-surgical methods are in use, and embryos are brought to the lab. They are evaluated. Then the embryos can be transferred to the recipient. The recipient must be nearly at the same stage of estrus, uh, same stage of the estrus cycle as the donors are. Say if the donor was in estrus on 1st of May, so the recipient must also be in estrus around 1st of May, or maybe 1 day earlier, or at the max 1 day later. The extra, say if you have one donor, then usually it is a program to keep 3 to 5 recipients. And say if you receive more number of embryos, then these embryos are put to cryopreservations. So these are the components of the embryo transfer. Now, as I said earlier, that the how donor is selected, the milk production, reproductive capacity, fertility, these are the criteria for selecting a donor. It should have proven fertility, it should produce high amounts of milk, and it should be free from diseases. So these are the criteria. Then donors and recipients must be on a high plane of nutrition, and they must be fed regularly with high energy diets. The recipients can be of poor genetics, but they should be of high fertility. You cannot select a recipient with a low fertility. It is very, very important that recipients of low fertility should not be included in the embryo transfer program. And then the bull or the semen that you are going to use should also be of high genetics. So the donor and the donor cow and the semen donor bull, or the semen that you are going to use as artificial insemination, should be from high genetics, uh, but the recipient may be of low genetics, but essentially high fertility. Now, how exogenous administration of follicle stimulating hormone, that is used for superovulation, it affects or it helps in induction of multiple ovulation. For this, we have to understand the follicular growth waves. As uh, we have talked earlier, there are 2 or 3 follicular growth waves. If follicles are recruited to grow, from among these follicles, one follicle is selected by natural process. This grows, and in the first follicular wave, it undergoes atresia. In the second follicular growth wave, it undergoes ovulation. So, how the exogenous administration of follicle stimulating hormone will help, we are going to discuss. Say this is a animal with a 3 follicular growth wave. 3 follicular growth wave, and you can see here 3 times the follicles are recruited, one dominant follicle forms, but the dominant follicle of the last wave, it undergoes ovulation. Now, what we are doing with superovulation? You can see here that from day 10, 8 to 10, 11, 12, we start administering exogenously follicle stimulating hormone. And uh, we can administer follicle stimulating here also for superovulation. But here, since the follicle of the previous wave was just ovulated and progesterone is not that high, so the response will not be appropriate. So we administer follicle stimulating hormone starting from day 8, 9 or 10, and administer it every 12 hourly to the donor. Now what this will do? This exogenously administered follicle stimulating hormone will rescue these follicles from atresia. And a large number of follicles, when they are rescued from atresia, all of them will become dominant and all of them will ovulate. So this is precisely the mechanism how administration of follicle stimulating hormone helps in multiple ovulations. Then the superovulation protocols. The superovulation protocol, the most commonly used protocol, is the administration of purified FSH, and that purified FSH uh, is currently available in the name of Caltropin V. There were many superovulatory purified FSH available previously, but currently only Caltropin V is available. So this is administered on day 10 morning and evening, 11 morning and evening, 12 morning and evening, 13 morning and evening in a decreasing dose schedule. Why? Because it is considered that the purest forms of FSH has some quantity of LH, and the quantities of LH would be detrimental to the growth of the follicles. So we decrease the dose. Say follicle stimulating hormone caltropin is dissolved in 20 ml, and uh, we administer say 2.5 ml on the first day, and then 2.2 ml on the second day. So 2.5 and 2.5 is 5 and 4 9, and then 1 ml 1 ml. So accordingly we can adjust the dose. Maybe we can dissolve it in a lesser amount of the diluent. And one day before the last dose of FSH, a prostaglandin is administered. What this will do? This will lyse the Cl of a previous estrus, and progesterone will decline. When the progesterone declines, all the there will be all the dominant follicles, they will reach the ovulatory size, and there will be a LH surge leading to ovulation. Then when the animal is detected in estrus, it is inseminated with high fertile semen, and from the day of uh, last insemination, the seventh day, the embryo is the uterus of the animal is flushed to recover the embryo, and then these embryos are evaluated and transferred to the recipient. So this is a protocol using a purified FSH Caltropin V. Now you can, if you don't know about the reference estrus, because we start the superovulation from day 10, and if you don't have a idea of the reference estrus, what we can do is we can insert a progesterone vaginal implant in the vagina of the cow, and 10 days from the insertion of this implant you can start superovulation. This is how, this is because when this implant is present in the vagina of a cow, it will release progesterone, and this will act similar to what a CL does. So the after day 10 you start the superovulation, and then you perform the protocol as usual, and you withdraw the progesterone implant after the last injection of the follicle stimulating hormone. Then using ECG could be a cheaper source of FSH, and one can inject 2000 to 3000 international units of ECG to cattle for inducing superovulation. But and then 2 days later inject a prostaglandin, and inseminate the cow and flush the uterus similarly. But because the half-life of ECG is more than 72 hours, so it will continuously stimulate and stimulate and stimulate the follicles. This will lead to uh, unovulated follicles at the time of embryo recovery, and sometimes you also receive the unfertilized ova, UFO, what is known as unfertilized ova, because these ova are liberated at different times, so they remain unfertilized. So this is a disadvantage of using the uh, ECG because it has got an longer half-life. FSH has got purified FSH has got a shorter half-life of 30 minutes. So it is cleared from the blood and then we have to repeat it at 12-hourly intervals. So it does not continuously stimulate the follicles. Then the cow has to be inseminated with high fertile semen, and the inseminator has to be very precise in estrus detection, and he has to inseminate twice at 12-hourly intervals. Then on day 6, what is suggested is that when you have superovulated an animal and you want to flush it the next day, it is always better to evaluate the ovulatory response. You have injected the follicle stimulating hormone, but what was the response? And this can be easily found out by transrectal palpation. A palpator just puts a hand inside the rectum, palpates the ovaries, and he usually finds a large number of Cl present on the ovary. If a large number of corpora lutea are present on the ovaries, he can even count the number of Cl on both the ovaries. Then, yes, definitely, the next day one has to recover the embryos. One can also use transrectal ultrasound to visualize the number of corpora lutea on the ovaries. Here you can see a large number of Cl are visible on the ovaries. Then what are the laboratory instruments? I briefly have mentioned a few of them. You require a pH meter because for the media that you use, the pH is very important. Then for all preparation of all media and all, you need a laminar airflow or a clean bench so that the air inside is not contaminated. You can use you may require weighing balances and a stereo zoom microscope. A stereo zoom microscope is different from a normal microscope because you can once you have adjusted everything, then you can zoom it without fine tuning. Then a hot water bath, you can keep the media at body temperature, and then a deep freezer to store things like the fetal calf serum or maybe some media or maybe some supplements that you add. Then you may require a hot plate to just keep things warm, and then a autoclave to sterilize the clothes and instruments, the stainless steel instruments, and a ethylene oxide gas sterilizer to sterilize the plasticware. You may need a ethylene oxide gas sterilizer, but when you are using a ethylene oxide gas sterilizer, you need to give some aeration because the presence of ethylene oxide gas may be detrimental to the embryos. Then how we recover the embryos? The donor from which the embryos are to be recovered is brought in a crate, and the perineum, this is the perineum, the perineal area is washed with soap and water, and then the epidural anesthesia using 2% xylocaine or lidocaine is administered so that the animal does not feel pain. This is a stainless steel cervical dilator. This has to be introduced in the cervix because on day 7 the cervix is closed, and since the cervix is closed, so this has to be dilated, and so that you can pass the catheter to recover the embryo. Stainless steel dilators are put inside the cervix, and slowly you just make rotatory movements. Extraordinary force is contraindicated that may tear the cervix at times. So you just go on rolling with a little of pressure. Extraordinary force is not advisable because sometimes you may rupture the cervix. Then a polycatheter, or maybe if you are using a three-way continuous infusion catheter, is passed through the cervix to the uterine horn. And uh, you found that this ovary is having 8 ovulations. You first pass it to this uterine horn. This polycatheter, it has a bulb, and when we infuse air inside, this bulb swells up. So, and this has a opening here, and then this end is connected to a Y junction tubing, and the fluid is passed inside. The fluid will go inside the uterine horn, and one has to keep his hand inside the rectum to monitor the amount of fluid that is gathered in the uterine horn. When it is full, you just stop infusing more fluid and open the opening wall, so that with pressure this fluid will come outside. Then once you have flushed this uterine horn, you can flush the uterine horn using 500 ml to 1 liter of the flushing medium, which is usually the Delbacos phosphate buffered saline, DPBS. Once you have flushed both the one of the uterine horn, we take out this catheter and we put it at another uterine horn to flush that uterine horn also. The embryos are free floating and they remain in the uterus. They remain free floating here. So when this fluid goes inside and returns back, along with this fluid, the embryos that are free floating in the uterine lumen will come outside. So that way the embryos can be collected. Now this is a polycatheter. It has two ends. A stainless steel steelette is introduced inside, and the forceps is applied over here so that it remains straight. Once the catheter is inside the uterine horn, the bulb of the polycatheter is inflated by passing air from this side. Once this is sufficiently inflated, we put a clamp here and close it. Then we take out the stainless steelette outside and attach the Y junction. This is a Y junction tubing. Attach this Y junction tubing to this end. This is a three-way continuous infusion catheter. This is a bit costly, but you need not to take out the stylet or anything like that. This is a continuous infusion catheter, and you can pass fluid and the fluid will be collected back through this. Then you need to have the embryo filters, because if you are flushing 1 liter of fluid and you collect the 1 liter of fluid and then you search the 1 liter of fluid for the presence of embryos, it will be very cumbersome. So we pass the fluid through this embryo filter. This fluid goes inside and the filter is raised slightly, so a small amount of fluid will remain here. Rest of the fluid will go out through these sieves. This will come out from this side, and uh, all the collected fluid is passed through this filter, so that only a small amount of fluid remains inside, and the rest of the extra fluid goes out. This is again another model of a embryo filter. If one does not have a embryo filter, what one can do, place it in a flask and then keep it for half an hour, or then the embryos being heavy bodies will settle at the bottom, discard the supernatant out, and keep this fluid for searching the embryos. This is the embryo flushing ready-made medium. One can prepare the medium in the lab by using the DPBS, which is dissolving it uh, in the requisite amount of water, but you can also prepare DPBS at your lab itself, but then you have to sterilize it, and mixing calcium chloride should be done at refrigeration temperature, otherwise there will be precipitate formation. So one can use DPBS powder crystalline form or the ready-made ones. The flushing medium has to be supplemented with 1% of bovine serum albumin, and uh, this one, it already has the 1% bovine serum albumin. It is also supplemented with antibiotics and other supplements you can also add to it. These are syringe filters. Once you are using the medium for the embryos, every time you use the medium for locating the embryos or for manipulating the embryos, you pass the fluid through these syringe filters. It will make the fluid sterile. These are basically used in the in vitro fertilization labs, but they also have a use in the embryo transfer labs. Now, this is how the flushing of the uterus is done. One person, he puts his hand inside the rectum, monitors the fluid inflow inside the uterus, and also say stop it. So a person standing with a bottle having the medium will close this inlet and then open the outlet. Once the outlet is opened, fluid will come outside, and this is a polycatheter being inserted inside the uterus of the cow, and you can see here the outlet is attached to a embryo filter. Now, in the handling of the embryos, one need to use some of these, the embryo exhorter, a micropipette. You can just attach a tip to the micropipette, but handling embryos, one should be very careful. If one is not familiar with handling the embryos under a microscope, then he must do some practice using oocytes from the ovaries, and because if you pick up the fluid suddenly, you leave this plunger suddenly, the fluid will go inside the pipette and it will never be recoverable. One can even use a syringe and needle, but it depends on the practice of the handler. Because embryos are live cells, one has to be very careful. Then one can recover the embryos like these ones, all at the blastocyst stage, or sometimes you can recover the embryos like these ones, say the morula type of the embryo, or maybe the embryo arrested at development, only the 8 cell or maybe the 16 cell. The embryos that are at the 8 cell or the 16 cell must be kept in culture, and after 1 or 2 days, if they grow further, they may be used. If they do not grow further after 3 4 days, then these embryos are dead. Or one can have the blastocyst type of embryos recovered from a single flush. This is a blastocyst. For embryo searching, one has to take the fluid that has been collected and search it under a stereozoom type of microscope, and plate, place the fluid in dishes, and one who does not have the practice of searching embryos, he can use the grid dishes, which has the markings inside, A, B, C. And one can see under the microscope what portion you have already seen, what portion you have not seen. But with practice, you can also use the routine dishes. Now, one can recover any sort of embryos on the day of embryo recovery. A unfertilized ova, a single cell, a two cell, a four cell, a 8 cell, 16 cell, morula, and then the blastocyst stage of embryo, hatched blastocyst. One can receive all types of embryos on that day. Now we talk about the embryo recovery. What is the proportion of embryos recovered? You see, I have put in a small table here. These are the animals which we flushed, the 1, 2, 3, 4, 10 animals, and you can see here we have used the same superovulatory regime for half of the animals. For another half, again we have used the same regime. The ovulatory response 6 in one ovary, 5 in another ovary, 5, 4, 3, 3, 2, 2, and this animal had no ovulations. Then this one had 12 and 10, and then 4, 3, 2, 2, 4, 3, 2, 1. Now this is where the morula type of embryo were recovered, only 3 in this animal. The other embryos that were recovered, poor quality of the embryos, 4, 4. So it's very frustrating that when you do not recover good quality of the embryos. But this is usual. Then the quality of the 3 embryos that were recovered from this animals were exceptionally poor quality, and poor response to ovulation. Only very poor response to ovulation. No embryo could be recovered from this animal. It is very usual. Don't be frustrated. Embryo superovulation, as Dr. Hasler has said, that the we have not been able to understand the ovarian physiology completely, and the biggest problem with embryo recovery and transfer is the superovulatory response. And then Battridge, he has said that from 100 cows that you use for superovulation will be only 30% which will give good quality embryos. So it is very usual, and this is because we have not been able to understand the ovarian physiology completely. And insights on understanding the ovarian physiology are on. People are working on it. Hopefully, we will have much more effective means of superovulating cattle. Then the embryo holding. The embryos can be kept at room temperature in the embryo holding medium. Embryo holding medium usually is DPBS with extra bovine serum albumin, 4% BSA. But one can also use the ready-made ones, this one or the Bovi hold. Sorry, 0.4%, not 4%, 0.4% PSA plus sodium pyruvate, because these will be these will provide the nutrients for the embryos. Then embryos can be kept in small drops of DPBS. You can see here multiple drops have been made in the petri dish, and usually you can use the pre-sterilized petri dishes. Otherwise, you sterilize them using appropriate measures. Then the embryo loading in the straws. For loading an embryo in the straw, this is, you can use the empty semen straws. a cotton plug. This is the cotton plug. You fill in some medium, then a air bubble, and then the medium with the embryo. Again a air bubble, again a medium, again a air bubble, and then we can seal this end by, or if you want to transfer it instantly, then you need not to seal it. The For these types of handling, again you can use a embryo exoter, or maybe you can use the micropipettes also. Once the embryo has been filled in the straw, it has to be transferred. One can transfer embryos using the AI gun, but it is always better to use the embryo transfer gun. The embryo transfer gun is not open from the front, it is open from the two sides, and the sheath of the gun is open from two sides, and it's not open from the front. The advantage of this is that if you just push the embryos through this, maybe the wall of the uterus may push the embryo back into the sheath. But if the embryo is pushed to the side, then the wall may not perform such type of action. So embryo transfer gun is a specialized gun which is longer as compared to the AI gun, because you have to move it up to the uterine horn. Embryos are transferred in the horn ipsilateral to the cell bearing ovary of the recipient. What I was mentioning just now, that embryos are transferred to the horn ipsilateral to the cell bearing ovary. Say this is a left horn, this has a CL. You need to transfer the embryo into the left uterine horn only and not into the right uterine horn. Because if you transfer it in the right uterine horn, the chances of conception would be very low. Now we talk of another important issue, and that is the pregnancy rates. It is usually reported that the pregnancy rates with embryo transfer vary from 54 to 68% in Europe and America. Hassler 2001. And the pregnancy rates reported for cattle in India were 38%. Dr. Mishra, he has reported, and 27% for the buffalo. So we had a project on the network project, and we superovulated 63 donors, collected 46 embryos, and transferred them to 28 recipients, and established 3 pregnancies and 2 live births. There was 1 abortion. So the pregnancy rates not only depend on many factors, but they are also factored by the efficiency of the personnel involved in it. So this is the recipient, and this is the donor which gave the embryo, and this is another recipient which received the embryo from a donor cow. Then we had a project on the multiple ovulation in Rathi cows. We superovulated 42 donors, collected 36 embryos, transferred to 22 recipients, but pregnancies were 0. Because of the quality of the embryos that were recovered, the quality was poor. And there can be many other limiting factors besides these, which will improve with time, and once you carry out the program continuously, then hopefully the pregnancy rates may increase, because then you start understanding the limitations and you try to correct them continuously. But this is our prized animal, because it gave 24 embryos in a single flush. The quality of the embryos was not up to the mark, but the superovulation protocol was successful. But the same donor, when it was superovulated later, it gave zero embryo. So it's really a difficult task because the ovulatory response is highly variable, and in spite of a lot of research, we have not been able to uh, minimize the variation in the ovulatory response. Then embryo cryopreservation. Once you have received more number of embryos, you can keep embryos at room temperature for 2 to 4 hours, at refrigeration temperature for 1 to 2 days, and then one can cryopreserve the embryos by using the different protocols. The cryopreservation that was previously being done using machines of these types or maybe other types is no longer advocated, and today it is advocated to vitrify the embryos. Vitrification is the uh, ultra low cryopreservation of embryos using high molecular weight cryoprotectants. And for this, the cotton plug, then the medium PBS, then there is a vitrification solution, then embryo in the vitrification solution, air, and then medium DPBS, and this is heat sealed. These straws are kept over the liquid nitrogen vapor for about 5 to 10 minutes and instantly then frozen in the liquid nitrogen. So using ethylene glycol ficol sucrose (EFS), the vitrification has been successfully done in many animal species. So friends, thank you very much for your patient listening. Kindly visualize the lectures completely, give your likes, share the video, give your suggestions, give your comments, give your suggestions for improvement, and subscribe to my YouTube channel Govind Narayan Purohit if you like it. So thank you very much. Have a nice day. Bye bye.